We are here talking about Daxon today. Why don't you give me a little bit of history on Daxon?
Yeah, so Daxon was born prematurely at 24 weeks, and he spent 6 months in the NICU with a lot of challenges. So he kind of, as you can imagine, he has a really medical or complex medical history. He had a brain bleed a few days old, and so he now has a shunt. He had necrotizing enterocolitis, so neck, and a few surgeries for that. He had eye surgeries because he had retinopathy or prematurity. I could go on for quite a while. Um, and he spent 6 months there, had multiple surgeries while he was there. And then since he came home, he ended up having to have multiple other surgeries. They figured out that he had craniosynostosis, so his sutures prematurely fused, which might have been genetic for me because I had that as well as a child or as a baby, but without a syndrome. His might have been from his shunt, but we're not sure. We've done all the genetic testing and everything was clear, but they're still improving technology and finding more syndromes. But so he had a lot of surgeries with that. The surgeries were to help make room for his brain to grow. And we've seen a lot of progress since those surgeries. Um, he's also had multiple surgeries for his shunt. He went from like a VP shunt to a BA shunt, with a few like infections in between, shunt failures. So he's had a lot. He's had a total of 16 surgeries.
Gone through a lot, both.
Yes. And a lot of infections, like hospitalized with RSV and
Determined along with a lot of antibiotics, a lot of different medication.
yeah, like necessary evils. He's had a lot of necessary evils. TPN, I think, was a hard one when he was in the NICU since he couldn't eat. So that did a number on his liver. Um, but and then since coming home from the NICU, we started PT within a couple of weeks. And so we've been in PT since he was just 6, 7 months old. And then we started OT shortly after that, and speech shortly after that, feeding therapy, because it was separate. Speech and feeding were separate at the time. So we've had hours and hours and hours.
There are lots of therapy for the little guy. Yeah. Yes.
Yeah, and he'll progress, and then he might regress, or he progresses, but just not as quickly as he should, spending all those hours a week.
Before you came in, tell me about what his condition was like, maybe some of the symptoms that he was exhibiting that let you know I need to seek alternative options other than traditional therapy.
So strength, kind of low muscle tone a little bit, from his cerebral palsy. He's there's just a lot with Daxon. He's a little guy, so strength. We're always working to build strength for him. Coordination is a big struggle for him. Balance is a big struggle for him, and some of that might be related to vision and the surgeries he's had. Some related to CP, and just being teeny tiny.
Yeah.
But the the biggest thing that we that we that we've been facing the last couple of years is this finger chewing. It started a couple of weeks after he had COVID, a few years ago, and it just became so obsessive, so compulsive. We worked with our OTs so hard. We were exhausting ourselves, and he was too. Like he would try and he would comply when he can, but he just doesn't even realize he's doing it sometimes.
It's automatic.
Yes. Yeah. We're in the middle of praising him for bringing his fingers down, and they're already back in. So he's getting like, skin breakdown. Not to mention it's not sanitary for him, which his immune system already struggles. And so we've just been trying so hard to find him a better outlet, a better way to get that sensory input. Nothing works. I shouldn't say nothing works. Sometimes stickers help, but now I think stickers have kind of become actually like a visual stimming. He'll do this with this hand and this the fingers in
Is
the
them both at the same time?
yes. So I would say that was our breaking point after 2 years of just fingers down, fingers down. I mean, hundreds of times a day. And it's like, just this is not working. This is not just a sensory seeking component. And so, um, we, I guess we're gonna get onto how we found you guys, if that's okay.
Yeah, this would be fine. You're echoing some of the things that I found in the exam as well. Just some extremely low tone, just almost no muscle tone, especially in the upper body or the glutes. Tons of primitive reflexes, which we can get into. But then, yeah, the one of the first things I noticed is he had that almost a compulsion to chew the hand. But then also there were some other things we found during exam with that basal ganglionic, almost a OCD type loop that he
Yes.
is just experiencing. So you were experiencing all of this, and then how did he decide to choose infinity as your next step?
So it was a lot of really, I don't know, signs from God. It was, we I kind of had emotional breakdown. I was like, I can't do this anymore. Like, this isn't sustainable to keep telling him, hands in the mouth. And it's kind of becoming negative in our relationship. And it was like, this is not what we want. We've got to find some other way to help him. And so the next day, they were just kind of kept like, I was brushing his teeth and I noticed he kept turning his head when we're on the side, which I had noticed that before, but something clicked with something that I had seen on social media. It's like, that's the rooting reflex. And so I pulled out my phone, I pulled up Instagram. Right at the top of my feed was the video that I was looking for, or that I was thinking of, which was really odd. And it was somebody in Australia, but then later in the day, I was like, I remember this friend that I used to work with. She posted about a year ago that she took her son to somewhere, and I was like, I think it was in Iowa or Indiana. It was Iowa. And so I called her, and she she took her 10-year-old to the Iowa Infinity, and after a week, they just saw amazing, amazing results. And I mean, so hearing her story and just how it helped her son, who I also knew her son, it was like, that's incredible. Because I mean, he had a lot of struggles similar to Daxon. Some different, but some similar with emotional regulation, like low frustration tolerance, and it just gave me so much hope. And I was like, this is it. And it just one step after the other. So I started looking at your guys' page and watching your videos. I went we went to PT later that day, and I talked to his physical therapist, and he was like, "What's the name of the place?" And he pulled it up. He's like, "This is the doctor I've been following. I've been following this place, researching them." He's like, "I know it seems not conventional, but they're having amazing results." And I was just like, there's just so many connections here. Even still later in the day, the something popped in my head. It was like a family friend had sent me something a few months ago, and it turns out it had been a year prior. It was one of your videos, one of your first videos. A little boy came. I think he had been misdiagnosed with autism, and just seeing like your facility and the activities you guys were doing, I don't know, God filled me with this peace that I've never experienced before, that this is the right thing to do. Um,
Well, we're super glad here, and now here in Colorado, and yeah, Iowa, which is really nice. Those kind of beautiful, beautiful mountains. You guys gotten to do also things here while you were here. But tell me, then you had seen your friend in Iowa experience these results. How have the outcomes been for you here with Dotson?
Incredible. Even day one, actually during the exam when you were testing his reflexes, I'm not a pro at it or anything, but I guess from seeing the videos before, I could see how terrible or how present yes, how strong his reflexes were, how present they were, and I thought I would be sad, but I was like, this is so validating. We're on the right path, and there's something we can do about this. And we're in the right place, and there are ways that we can help him. And so even day one, after he did just an hour of therapy with you guys after the exam, his speech that evening, we were really blown away.
A little bit about how his speech was before his sound. We touched on that.
Yes, he had quite a speech delay. The I would say in the last year, his speech was flourishing for him. And, but man, it just, since we started this, it's really picked up. So before he did a lot of, the most recent thing, he did a lot of repeating, what we would say, which was great. It was so exciting. And he, but he still struggled with a lot of different sounds, and he still does, but a lot of those have improved. Today he said his teacher's name from school back home, Mr. Z. He's never been able to say Z before, and he was so proud of himself. And I mean, every day now we're seeing he's putting multiple words together. It's more spontaneous speech. He's really understanding us very well. His receptive language was strong before, but it's even stronger now. And he's telling us while we're driving, like, what color car we passed without me prompting him. He's telling us, like, oh, that guy was wearing a jacket in the car. Like, he's telling us what he's observing, and it's amazing, and it feels a little bit even more conversational. And
It's a window into his little mind. He's thinking, and he's able to express that finally.
yeah.
I know when he first came in, one of his favorite activities is swing.
Yes.
And he would say, swing up. And he would want us to put him up into the swing. And then day 2, we realized, okay, who wants to go? Dr. Tess wants to go up. And he would say, swing up. And, visibly be a little bit frustrated. And we were trying to prompt that a little bit to say, I need a little bit more. And he learned very quickly to say, I want to swing. And it was just like light bulbs for us to say, okay, and like he has this language, and he needs the confidence to be able to say it. And sometimes he needs help with some of the bigger language, right? But he's starting to use words like I and you and my as these 3 weeks have gone by, which has been really cool to witness, going from 2-word sentences to him making up these 4 and 5 words. 4 and 5 word sentences that just express his needs and his wants and where he wants to go next. When he's done with an activity, will definitely let us know. And so giving him some autonomy with that to say, like, thank you so much for telling me what you want. Yes, we can move to the next activity, even if we're not completely finished yet. Just letting him know that, like, his words carry so much power. Yes, and just to see his little confidence build, yeah, amazing.
Yes, it's been wonderful. I mean, he's using positional words like next to, by. The other thing he's doing too is he'll explain something in 2 different ways. If I don't understand, or I'm like, I might understand, but I'm like, what are you talking about? And then he'll say it in a different word. Like, he might say sweeper, and then I think he did that with Miss Lauren the other day. He said sweeper, and then she's like, are you talking about sleeping? And he said, he waited a moment. He's slowing down, pausing, and he's like, vacuum. Like, he wanted the vacuum.
He's like thinking of alternate words for the same object, which is
Yes. Yeah, and we never saw him do that before, and we didn't see him slow down or pause and think about how to say this, or he might be trying to say a phrase and he messes it up, and he tries again. He keeps trying until he gets it, which is, it's that's a new behavior.
Yeah.
Yeah. And
Yeah, I think it's also important to note that we haven't worked on specific speech for anything. We don't press him for speech tasks. We don't go over, certain words or have word charts. We've truly been working on that foundational piece of energy production and decreasing inflammation in his brain. And then working on those primitive reflexes, core stability, just really those foundational pieces have been huge for him. And we're seeing those higher cognitive tasks come, the speech come with that. And of course, we do use a laser speech protocol.
yeah.
But aside from that, nothing has been specific to speech therapy. It's just our neurological, our functional neurology therapy, which
Yeah.
has been awesome to see.
It's incredible.
And talking about primitive reflexes, so, he had the very strong reflexes in the beginning. We also noticed that low tone. And so when we say that we're going back to these foundations, one of the things that we've been working on is the strength and balance and coordination with him through these primitive reflex work. Tell me, I showed you a video of him balancing on a half moon ball, which, for a kid who doesn't have balance and coordination, he's standing on this ball toward the end of the 3 weeks, hitting a balloon back and forth. So he is on that timing component, that motor planning. How does that resonate with you?
That was incredibly exciting to see. Balance is so, so, so hard for him. Even just stepping up onto the curb, it's a process. And so to see him up on that ball unsupported, I know he couldn't do it unsupported in the beginning, and now that he's doing it unsupported, he's getting down by himself. It's incredible, and I think I know that's really going to help him keep getting stronger. It's just exciting to see.
Yeah, and then we also had him on the vibration plate in those planks, and in the beginning, he could handle maybe 2 or 3 seconds. On straight arms, he just didn't have the upper body strength. Um, Yesterday, we had him 3 times 30 seconds on this plank where he's just he looks like a little athlete now.
Yeah.
So that's also been really cool to see just his strength. And then there were some really hard and tough, stressful moments for him. And we videoed those to show you just how he was coping, and that emotional regulation sometimes can go out the window when these kids are learning a new skill, or maybe they're being challenged in ways that they've never been challenged in other therapies. And so we had him there on that half ball. And while sometimes he does really great and there's no crying, and sometimes he's just visibly a little bit stressed, but in a good neurological growth kind of way. Yeah, the distress, right?
Yes.
Tell me how that made you feel to know whenever he comes off of that ball and those tears immediately dry and his little face just beams. They say, "You did that, Daxon. You did that."
Yes.
Like his confidence just all around has been an improvement.
Yes, it's been wonderful to see him experience pride and like being so proud of himself. And we talk about that a lot with him, especially in the last few weeks, that you should be so proud of yourself. It's incredible. And to see him kind of upset during the exercise or the activity, but he's still doing it. He's expressing that he doesn't like it, but he's still doing that. And
These hard things,
yes,
the things, and I'll say,
yes.
"It is brave." He'll say, "I am brave."
And I promise. I promise. Yes, it's incredible. I mean, and he needs that for his confidence because confidence has not been totally there. He falls a lot, and so because of the balance, the coordination, and so I know that's going to improve. And as we see his confidence improve, that'll really help too.
Yeah. What would you tell another parent that is on the fence of maybe doing some of this therapy? Because I know you've gone through PT, OT, speech, beating, all of the things, and all therapy is therapeutic, all great things. So maybe that parent who's trying to take the next step and decide to add another therapy, or maybe, how do you decide to take this big leap?
Yeah, so if you're on the fence, you're in the right place. This parent probably has exhausted all their options. They have been looking for answers, looking for help. They've probably come across doctors who aren't really hearing them, or, oh, well, let's try this medication, or well, let's try this, or maybe they have that, or and nothing's working, or you're just not seeing enough progress, kind of like where we were. I would say take the leap of faith because as soon as we started the process, I knew we would not regret this. We've been blessed enough to buy the home laser and automatically enrolled in the program, watching Dr. Josh and Dr. Lauren's, videos and learning about all of that. It's incredible. I think what you guys have, I don't want to say stumbled upon, but learned and figured out, like we're starting at the mitochondria, which is like you're starting at the very, very bottom. We're not, I know we're not here like curing and everything, but we're strengthening and like fortifying their foundation. And I,
Such an excellent point. Do you always say is your kid is coming in at a lower potential than they could be at. And so our job is to figure out where those gaps are and increase their potential. And I think Daxon is just an amazing example of that, from his strength and his balance, coordination, his speech is flourishing, his confidence is just through the roof now. So that's just a perfect example of how when we work bottom up from starting at that mitochondrial level, primitive reflexes, balance, vestibular, and all the way up, we can get to that higher cognition and just be able to be more functioning as Z. He's more independent now probably than he was before coming in.
it's true. Yeah, which is beautiful to see. Yeah. And I think when you're talking about, I think I don't know, our culture is kind of in this conventional versus functional or holistic or whatever word you want to use. And it's tricky finding the right balance. There's a place for everything. Not putting down conventional medicine in any way, but s- Daxon's been on a lot of medications. He's had a lot of those necessary evils we've talked about, and it's I think that it's time and it's a blessing to have this opportunity to work from the foundation, like from a functional perspective. And so we're seeing, or we're able to do now the laser at home and do this is non-invasive, it's safe, it doesn't hurt, it's fun. He can do what he's doing and we can do what we're doing.
Therapy and doesn't even know it.
Yes. He's worked really hard here and he has no idea. He's been so happy to come here every day.
We're super excited to see him every day. Ray of sunshine is shining through, and the more times he comes in, the more words he starts saying as he's coming through, and he just interacts with our staff up front. One thing that I forgot to ask you about that you had mentioned to me earlier in the week is you guys had a family event socially, and I know social challenges were a big deal. Tell me how he began interacting with other kids his age. What did that look like?
So before coming here, Daxon is so interested in other kids. He goes up to them, approaches them. Personal space is not totally there yet. I've seen that improve. So we were able to visit with a cousin of mine, and she had a couple of kids, and he sat down in a group and played with them. Instead of just parallel play, it seemed more interactive. And he approached a little boy the other day, and he practiced a little bit more personal space. I'd say he was making really good eye contact, and he accepted that this little boy didn't want to hug because he's a hugger. And so socially, we're seeing progress with kids and adults too. Just how he's socializing, he's speaking.
Yeah, Heather is able to express his needs or his wants.
Yes.
So, well, thank you so much for doing this interview today. I think this is going to help a lot of parents with kiddos like Daxon and on the fence, similar to how you were coming in. Colorado being a new office, it's just so important for us to get the word out that, we're doing big things and these kids' lives are being changed every day. We have amazing staff here. They've all been incredibly trained with all of the same neurology tactics that we use in our Iowa clinic. And, thank you so much for just being able to tell your story and how amazing little Dux is.
You're welcome. And thank you for all your help and support.
Support you. I'm going to send you with a home plan. You guys have the laser for home use already. We've talked a little bit before this interview. Ask any questions that you have. We can make those adjustments as we go and just really make sure that we're sending him on a good path for success for the future.
Thank you. We're excited to see what the future holds.